Hello. So today let's talk about the connection between lifestyle choices or lifestyle factors and inflammatory back pain. Now, for executive moms who are juggling a high stress job and managing younger kids, understanding the link between your lifestyle factors and inflammatory back pain is quite important. Now, inflammatory back pain is not just a result of physical strain, but it can be significantly influenced by your lifestyle choices. Now, in this video today, we will discuss about excuse me, how your lifestyle choices or factors can influence your inflammatory back pain. And then I'm also going to talk about how you can reduce the inflammation in your back and thereby reduce your inflammatory back pain. Now, the before we get into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back and neck, and nerve pain. And I do this, and they have this nerve pain despite low energy levels and brain fog. So that is the mommy brain that we usually talk about. Now, I do this by giving you simple exercises, some easy lifestyle modifications, some tips and tricks that have helped me in my own spinal, joint, and nerve pain and my adrenal fatigue journey. Now, by adrenal fatigue, in case you're not familiar with that term, I mean the low energy levels, so low that you cannot even get out of bed, cannot even roll out of bed, really. And also, mummy brain or lack of focus and concentration or brain fog. Now, I do all of this without taking away a big chunk of your time because, hey, we're moms, we're busy people, right? So let's talk about the topic for today, which is the understanding the connection between your lifestyle factors and inflammatory back pain. Now, a very brief introduction to inflammatory back pain before we get into the lifestyle factors is sometimes when we have inflammation in the back, inflammation is basically a natural healing process of the body, or rather the immune system of the body, that comes about when you have an injury, when you fall down, say you've scraped your knee. So the inflammation comes into action and then the healing process starts. But when this inflammation goes on for a long period of time, that itself can cause more stiffness and pain. And specifically, when it comes to your back pain, it can increase your back pain in the long run. So inflammation is a good thing. However, when it's chronic, it needs to be checked. So, this is a very brief introduction and a very superficial introduction to inflammatory back pain. If you're looking for more details, you can check out the other videos that I have done about this. And you can go to my YouTube channel, or you can check out, you can just search YouTube inflammatory back pain or back pain Swati Prakash, and a couple of videos that I've done will pop up for you. All right, so let's look at the first lifestyle factor. Firstly, is if you have a sedentary lifestyle. Now, don't roll your eyes on me for this one because I know this is so commonly addressed that it's become white noise now. But sedentary lifestyle is one of the primary contributors to inflammatory back pain. Yeah. So, long hours of sitting, whether that's for meetings, whether it's for work, whether it's for travel, especially in a non-ergonomic position. Now, what do I mean by non-ergonomic position? Is basically in a poor posture, and poor posture is somewhere where your joints and your spine, the structures around in your spine, the ligaments, muscles, etc., are not in a neutral position. So they're not in a happy position. And that leads to a poor posture. There's increased stresses on those structures. That can increase the inflammation in your back, or it can lead to inflammation in your back and thereby increase your back pain or introduce inflammatory back pain into your body. Now, for executive moms, you're spending a lot of time at your computer, at your desk, in your meetings, as I said. It can exacerbate your pain and inflammation. So, what is the solution? Regular breaks. Now, regular breaks are very important. And in these breaks, if you can manage, you can do some desk based exercises. These are just simple movements that do not take more than 2 to 3 minutes of your time, or you can walk around, get up, just stretch. So, do what you can to mitigate or decrease these effects of a sedentary lifestyle. Some people even adapt their office area for more ergonomic furniture. Again, you can find the details on my YouTube, or they can have an adjustable standing desk where they're standing for an hour, then they're sitting down for the next hour and taking breaks. Regularly changing their positions like that. And of course, taking regular breaks. Now, if you're interested in some desk-based exercises, I have a free video guide on this. And I have written a blog on the relation or the link between your lifestyle choices and inflammatory back pain. So I will leave that blog in the description of this video. If you're watching me on Instagram, the blog will be in the link in my bio. You can always message me for the link. In that blog, I have left this free guide for you, and there are a couple of other things that I have also got in that blog. I will address them as I come across these. So now the very next one is your sleep quality. So again, this is something that we are all aware of, but poor sleep can lead to increased pain sensitivity, increased inflammatory response. Basically, what that means is ensure that you get quality, adequate, high quality rather, sleep, and that is very crucial. So establish a bedtime routine, create a comfortable sleep environment, have a pillow and a mattress that is appropriate for your body type. Again, you can go to my YouTube. There are lots and lots of videos I've done on pillow and sleep positions or postures. Avoid caffeine, screen time before bed to improve your sleep quality and to reduce the inflammatory back pain. For myself and for my kids, for my family, I use essential oils. Please, please, if you're using those off the shelf, you'd rather not use those. Use high quality ones. Again, I will leave a link in the blog to the ones that I use. Sorry, just a bit sniffly here. So I will leave a link to the blog in the blog to the essential oils that I use and I recommend. So there are quite a few of those, but you can choose which ones that you want. If you're not sure, you can always contact me and I can help you out. Now, another thing, another lifestyle choice or change that you could look at is your ergonomics. Now, ergonomics basically is the position of your body in space. Now, proper ergonomics is that your workstation is such that prevents strains and reduces back pain. I have done a number of videos on this. Have a look at those. But in a nutshell, you should have a chair where you have proper, like this chair here that I have, it has a proper neck support, support for my lumbar curve. It has got armrests where I can place my arms. And when I'm sitting down, the forearms here, they are supported by the table. So, and my wrist is in neutral. It's not up or down, or it's not tilted to the left or right. So it is in a neutral position here and in a neutral position here because I use a wrist pad for my mouse and for my typing for my keyboard. So these are some of the changes that you can do to ensure that you have proper ergonomics when you are at work. And this lifestyle, of course, I'm talking about the hand here, but of course, the lumbar support when you're using that, or if you don't have a lumbar support, roll up a butt towel, put it into the curve of your lumbar spine, or stick it to your chair. Just use some, there are lots of hacks out there. You can have a look at those, or just stick it to your chair and that will give you a lumbar support. So that will avoid back pain or an aggravation of your inflammatory back pain. So there are lots of things that you can do when it comes to ergonomics of your office furniture. I will leave a link to the lumbar support and the other ergonomic furniture that I recommend in the blog again that I mentioned just now. Okay, so there are quite a few points, and of course, I've discussed them in details in the blog, but the last one that I wanted to talk about is your diet and your nutrition. Okay, again, this is something you might be aware of, but your body has got a very, very good healing power. So basically, our bodies are very good at healing themselves. We just have to provide it the right tools. And one of the out of the many tools that the body needs to heal itself, one of the most important is your diet and nutrition. Of course, I'm not qualified nutritionist or a dietitian. However, what I have realized from my own pain journey and my adrenal fatigue journey is that when you're eating foods that are high in processed sugars or processed white flour, unhealthy fats, of course, these are all inflammatory foods, and especially the sugars are highly, highly inflammatory. they can go and increase the inflammation in your body, but especially in your back. If you already have back pain, they can increase the inflammation in your back pain. So a balanced diet that we all of us are aware of, we have all heard of. I'm not going to tell you which ones, what to eat and what quantities to eat. However, a balanced diet, something that grows out of the soil, does not come out of a packet. Not all packaged food is bad, but mostly does not come out of a packet, will be good for you. Now, you may ask, now, how do I reduce the inflammation if it's there in my body? So, what you can do is there is a 11-day program that I joined probably about 1.5 years ago. With that, I managed to get my back and neck pain down to absolute zero. Now, I am a healthcare professional. I know exactly how the body works. I know how to get rid of my back pain when I have it, or how to manage my neck pain. But believe me, I could never get it down to a zero, even though I have decades of experience. With this 11-day program, I reduced the inflammation in my body. It's the back and neck pain has gone down to zero. My knees that were, I have a meniscal problem with my knees, which had been present for over 2 decades. That has gone down by about 75%. So this is a free program. What I'll do is I will leave a link to this program. You can have a look at the testimonials so you can see what people are saying about it. You can have a look at the details of this program. I will leave a link in the description of this video. And if you're watching me on YouTube, if you are watching me elsewhere, the link to this program, this free 11-day program. I mean, come on, we can do anything for 11 days, right? And if it's something that really helps your body, why not? So this link to the free 11-day program, I will leave it in the blog that I was talking about. And the link to that blog will be in my bio for those of you who are watching me on Instagram. For others, it will be in the description of this video. So have a look at that. And let me know if you have any questions, any comments about the program, about the video today, or any other questions about your lifestyle choices or